Hi, I'm Maggie Vires, and I will be presenting on Chapter 17 about blood. So here are the functions of blood, and they can be summarized in transport, regulation, and protection. For transport, we see that blood moves oxygen and nutrients throughout the body, and it also removes waste and transport hormones. Regulation, blood absorbs heat from parts of the body like muscles, and it redistributes it to regulate the temperature. Blood also regulates the pH and keeps it around 7.4. It does this through blood-borne solutes, and they act as buffers to prevent changes in pH. For protection, hemostasis is one example, and it protects the body from too much blood loss. Blood also contains antimicrobial proteins and white blood cells, which help prevent infection. So what is blood? Blood is a connective tissue composed of warm elements, and it is suspended in a fluid matrix called plasma. Although it appears uniform, blood contains erythrocytes, and these transport oxygen and make up about 45% of the blood's volume. Leukocytes, or white blood cells, and platelets are involved in immune defense and clotting, and these make up about 1% of the blood's volume. Plasma makes up about 55% of the blood, but it consists of mostly water and other dissolved solutes. Blood color varies depending on oxygen content. If it's oxygen rich, then it appears bright scarlet, and it appears dark red when oxygen poor. The average blood volume is about 5 to 6 liters in men and about only 4 to 5 in women, and it makes up about 8% of the total body weight. A little more about plasma and blood cells. Plasma makes up the liquid portion and is composed of 90% water, although it has over 100 dissolved solutes like electrolytes, proteins, nutrients, and gases. The major plasma proteins include albumin, globulins, and fibrinogen, which are mostly produced by the liver, and this makes for about 60%. Other things you will find in the blood are red blood cells, which are the most numerous formed element, and they lack a nucleus, and they make room for hemoglobin to carry oxygen. White blood cells are the only fully complete blood cells, and these help with immune defense. Platelets are cell fragments, and these play a role in stopping the bleeding and help form clots. Most blood cells live only a few days and are continuously replaced by the hematopoietic stem cells in the red bone marrow. Erythropoiesis and RBC lifespan. Red blood cells are produced in the red bone marrow through a process called hematopoiesis. During maturation, they develop into a reticulocyte and then a fully functional red blood cell over 15 days. The hormone erythropoietin, which is released by the kidneys, stimulates the production of RBCs. The production of them requires iron, B12, and folic acid from the diet. Red blood cells usually live from 100 to 120 days, and after they are destroyed in the spleen, their components like iron and globin are recycled. So what are leukocytes? Leukocytes are often called white blood cells, and these white blood cells are produced in the bone marrow through leukopoiesis. Leukopoiesis is stimulated by interleukins and colony-stimulating factors. White blood cells leave the bloodstream through diapedesis to reach infected or damaged tissues. They move using the amoeboid motion and are guided to infection sites by following chemical signals, and this is called chemotaxis. The two categories of white blood cells include granulocytes and agranulocytes. Granulocytes consist of neutrophils, eosinophils, and basophils, while agranulocytes consist of lymphocytes and monocytes. The functions of white blood cells. Neutrophils are the most abundant, and they specialize in killing bacteria through phagocytosis and respiratory burst. Eosinophils are especially effective at fighting parasitic infections. They also play a role in allergic reactions and asthma. Basophils are the rarest white blood cells. They release histamine, and this helps trigger inflammation during immune response. Lymphocytes include T cells, which attack abnormal cells, and B cells, which produce antibodies. Monocytes account for 3 to 8% of white blood cells, and they develop into macrophages. These digest pathogens and help activate the immune system. So what are platelets? Platelets are fragments of cells and not complete cells. They contain several chemicals that are essential for clotting, like serotonin, calcium, enzymes, ADP, platelet-derived growth factors. They originate from large bone marrow cells called megakaryocytes. Their main function is to stop bleeding by forming temporary plugs at the sites of vessel injury. If not used, platelets circulate in the blood for about 10 days, and during this they are kept inactive by nitric oxide and protosalin. Platelets are made from megakaryocytes, as we've seen on the slide before, and their hormone thrombopoietin regulates the production. Platelets develop into megakaryocytes and extend portions of their cytoplasm. When platelets develop when megakaryocytes extend portions of their cytoplasm into nearby blood vessels. Platelet production mainly occurs in the bone marrow and the lungs. Blood transfusions. Plasma volume can be replaced by electrolyte solutions to maintain the blood pressure and hydration. Packed red blood cells are used to restore the blood's oxygen carrying capacity after significant blood loss. It's important to know the different blood types, and these are determined by specific surface proteins called antigens. And antigens are found on the red blood cells. If the wrong blood type is transfused, the recipient's antibodies will clump the foreign red blood cells. This can potentially block blood vessels and damage the kidneys. To ensure a safe transfusion, blood typing and cross-matching are performed, focusing on the ABO and the RH blood groups. The diagnostic role of blood testing. Blood tests provides valuable insights into a person's overall health status. Anemia is a condition characterized by low hemoglobin and often a low hematocrit. These indicate a reduced oxygen carrying capacity of the blood. A high fat content in the plasma, known as lipidemia, may give a yellowish tint to the blood and indicate that there is increased risk of heart disease. Blood glucose levels reveal how well diabetes is being managed. And an elevated white blood cell count, called leukocytosis, is often a signal of infection or inflammation. Assessing clotting and platelet function. Blood tests can evaluate the function of the hemostasis system. A platelet count helps diagnose thrombocytopenia, a condition with low platelet levels. Prothrombin time measures how quickly blood clots and is often expressed as the INR, or International Normalized Ratio. Abnormal clotting times may indicate bleeding disorders or the need for anticoagulant therapy. Routine diagnostic panels. Two common diagnostic panels are the complete blood count and the comprehensive metabolic panel. For the complete blood count, it measures the blood cell counts, hematocrit, hemoglobin, and red blood cell size. For the comprehensive metabolic panel, these include levels of electrolytes, glucose, and markers of kidney and liver function. These tests are routinely ordered during checkups or hospital admissions. Together, they provide a detailed snapshot of a patient's general health and organ function.